This is Dr. Ann-Louise with a New Day Pediatric Psychology in San Antonio, Texas. And fall has officially arrived. Hi, thanks for joining. Hello. So we are going to wait for a few of you all to log in, and then I will have Dana join us, who is our special IG live chat guest today. We are going to be talking about SIDS, or Sudden Infant Death Syndrome. And it is SIDS Awareness Month, and Dana Nethercott is a pediatric physician assistant living in New York and practicing in Connecticut. So let's bring her on here.
Good morning.
Good morning. All right, can you hear me okay, Dana?
Let's see if we can try this again. I can hear you, but I don't think
you can hear me. I can hear you. I think I'm good.
How do I sound?
You sound perfect. I can hear you great. Awesome.
Hold on, I'm going to have to reconnect my Bluetooth because it seems to have dropped out.
Okay. All right, we're going to make sure that we have our connection, and we'll just join her back if anything. All right. Are we good?
Perfect.
Okay. Great.
Thank you.
Okay. So, again, this is Dana. She is a pediatric physician assistant, and in Connecticut, rather. So your fall probably has hit already, which is nice.
Just today. It was freezing. Yeah. It was in the 70s and 80s all week, and it is now very cold today. It feels finally like October.
Like it's October. Okay. Yeah, it's been really warm here in San Antonio, and yesterday I was on a field trip with my son at the Wild Animal Park, and I'm like, okay, it's hit. It's 60s, which is, a big drop from 90s. So, but today I'm ready. So.
Me too. I got the turtleneck feels good.
There you go. So we have a few people who've joined us already. So what we're going to do is go ahead and just jump right in and kind of talk about this really sensitive topic. But I think it's really important because we don't hear enough about it. I think we go through waves of talking about certain topics. And I think this is an important topic. So why don't you go in and start letting people know about SIDS and the facts, the stats, the risk factors, and how we can prevent this from happening.
Sounds great. I've been practicing for about 10 years. So I can say I'm very lucky that our practice has not experienced a large number of SIDS deaths, but we have, right? So this is not something that is not occurring. I think people misunderstand, we do talk a lot about, and this is a small example though, important this time of year, like the number of pediatric deaths from flu last year. Let's just use it as an example. Maybe a little under 170 children died from flu last year. 3,500 children died from SIDS or other sudden unexpected infant death, right? So SUID is an umbrella term and SIDS is underneath it, which includes not only sudden infant death syndrome, SIDS, also includes unknown or undetermined infant death, because there is not across every state a consistent ability for certain coroner's offices to make that distinction. And so there is infant death that is also not categorized, and then strangulation and asphyxiation. All of that falls under sudden unexplained infant death, and which of course includes SIDS. So I feel like that's a big number.
Yeah.
That is not getting the kind of attention it really deserves, either because since the Back to Sleep campaign started in 1994 from the American Academy of Pediatrics, by the late 90s, the number of SIDS, deaths attributable to SIDS had declined by about 50%. Really, the graphs are really impressive from the early 90s right into 99, 2000. And then it plateaus, and then it stops. And there are, in the early 2000s, and then particularly 2015 and as recently as last year, little upticks, actually. So we're not going in the right direction. I don't know why it necessarily doesn't get discussed as much, outside of the fact that it's simply not pleasant. And I feel like we're doing a real disservice to the children who do succumb to SIDS by not being louder about what we can do that first year to prevent it.
Right. So what you're saying is that once the American Academy of Pediatrics started looking at the numbers early 90s, and we started implementing some things, which we'll talk about in a moment, then we saw the rate of SIDS go down, and then they just stopped going down. They didn't get worse. They just kind of just plateaued.
They plateaued, with some years seeing a little resurgence, right? Never to the levels of the early 90s and before, but no other significant either breakthroughs or reduction in the rate. And so while, yes, I understand in the 70s and 80s we were having more like 7,000 or more deaths per year due to what used to be called crib death. Right. I'm not saying that, obviously thousands and thousands of babies have been saved by telling families to put their babies on their back when they go to sleep. But then either that momentum slows down, and so then it sort of gets lost in that first year of life when there's so many different recommendations of what to do and how to do it. That I think that piece has been lost. I don't want to say forgotten, but maybe not. Maybe the emphasis on the safe sleep is either not clear as to how important it is, or it's ignored. I don't know. I don't know. Because caregivers are at fault here too. There is a statistic that says up to 45% of families in those early visits with their healthcare provider are either not given any advice or incorrect advice.
Wow.
Is that also a reflection of the fact that we get 15 minutes with a baby during those well visits, maybe even 5 minutes, depending on the situation? I'm not, it's not an excuse, but there are other things in play here where I can see where sometimes this information is not being communicated.
Right. So they're not being informed enough to make an informed decision about it. So that we have to make sure that we're doing better in terms of letting families know that, well, as a caregiver, how do you know what to do if you're not told what to do? Because it's so much information. I remember when I first had my baby, I had been teaching people for years, even working in the well baby clinic as a psychologist. But when I first brought her home, I was scared. I had no clue what I was doing, and all the information that I knew fell out of my head. So, it literally, I was so scared when they wanted to discharge me from the hospital. I was like, I'm not ready yet. Like, I need more information. So it's scary. And, then when you're seeing your pediatrician, you don't feel like, I don't know what to ask, and I don't know what I don't know. So then what do we do?
I don't know what I don't know.
Exactly.
Right. So why I think sharing information in this more personal way, not necessarily just, telling families, just go to the CDC's website. I don't feel like that's going to communicate as well as it is when it's coming from a trusted person like yourself. And hearing firsthand that some things that you may have read or heard or feel are the right thing to do may not be.
Right.
So if we're talking about what happened in the 90s, in 94, it was about 24% of families, caregivers, right? People who caring for infants, 24% put their babies on their back to sleep. That was it. By 99, after the American Academy started promoting very aggressively, put babies on their back, because literature came out showing that these infants who were succumbing to SIDS were almost exclusively on their stomach, right?
Okay.
Said, well, let's put them on their back. That seems like an easy solution. And by 99, when we were seeing that, by that, we had finally hit that 50% reduction up to 65% of families. So the message got out, but things have stagnated. So in 2016, so that's how long this sort of, and not saying there weren't improvements, it's amazing, but nothing changed. So in 2016, the American Academy said, well, let's start promoting not just back to sleep, because there's clearly other things at play here. Because families, I think by now, have understood that is the safe way to sleep. Right. That is not a mystery. So it's changed from the back to sleep campaign to the safe to sleep campaign. And this is a little different in that the back to sleep always is still the number one first recommendation, no question. But I think as an institution, as a pediatric, steward of our advice, the AAP has also noticed that there are other things at play than just being on a baby's back, a baby being on its back, as far as promoting safe sleep.
Okay.
So if we can, before I go on what to do, currently, these are statistics from 2015, so these are not old. Overall, 22% of families are still not putting the baby back to sleep, primarily in the African American and Hispanic communities. The other piece that is interesting is of that 22%, it is primarily mothers 19 to 24 years old who are making the bulk of this percent of families who are not putting their infant on their back. Bed sharing, 61% of families responded as bed sharing under the age of 1. And
is that another risk factor?
That is a huge risk factor.
Okay.
Up to 84% of that 61% were made up of American Indian or Alaskan Native families.
Okay.
So some of these statistics I felt like actually weren't too bad. 22% still putting on their back. 39% of families maybe still using soft bedding in the crib, which is a risk factor. Baby bumpers, blankets, stuffed animals, the rest of it, right? This is all under the age of 1. I don't know if those surprised me so much. Right. I feel like all the Instagram photos of the crib is of the bows and the bedding and the pillows and
gorgeous
the stuffed animals. 61% of families responding as saying yes to bed sharing, meaning the baby under the age of 1 is in the bed with the parent or caregiver. I thought was eye-opening even to me as a seasoned primary care provider. And so this data clearly is data that the AAP knows, which is why I believe the campaign has taken a different track and promoting safe sleep environments, not limiting their advice to just making sure the babies are on their back.
So risk factors are the soft bedding with all that extra stuff that's gorgeous but unsafe for the baby. Not putting them on their back, so usually on their stomach. The bed sharing, so they're sleeping in the bed with the caregiver.
That's right.
What other risk factors are there?
There are certain categories of infant that are at higher risk than maybe a full-term healthy infant. So infants that are preterm, which is under 36 weeks. Infants who have recently had a respiratory infection. And infants with brain defects, chromosomal abnormalities, and genetic birth defects. Those categories are particularly at higher risk. But even for a full-term baby, there are a couple of other risk factors that will put you certainly at higher risk for SIDS, including secondhand smoke exposure. Even not even just first, right? So not even family smoking in the home, which of course is a risk factor, but even a parent or caregiver who smokes not in the home, but has that debris and carcinogens on their person, is a known risk factor for SIDS. And we have the bed sharing, the stomach sleeping, are the primary biggest ones, particularly the soft bedding.
Yes. Okay.
Soft bedding.
So then with all those things, then what are ways that we can, I mean, it seems like a lot of those things are things that are within our control that parents can actually control, except if they've had, if they're premature, if they're respiratory infections, brain defects, chromosomal or genetic stuff. I mean, it's already kind of happening. The child is already experiencing it. We can't do much about that specifically. But a lot of these other things are behavioral things we can actually change to reduce or even eliminate the risk. So what are some very practical prevention strategies to decreasing the incidence of SIDS?
So this is where I think we can really empower parents. There are so many easy, healthy habits that we can employ in the baby sleep environment that may not make for the cutest Pinterest image. I understand. However, I think the onesies out there are adorable. So I don't see why anything other than your baby is needed to make a picture cute.
So just a fitted sheet and that's it.
That is it. Don't put anything in that crib but a fitted sheet and a baby. That's all it's for. And it doesn't and the crib is a good point, but this is the other thing is if you're room sharing, because number one, the baby has to be on his or her back. Plain and simple. There is no other reason other than that you didn't know, right? That the baby has to be on its back to sleep. Right. The second piece is that the surface on which you put that baby to sleep, right? So what does that look like? It has to be a firm mattress. If you are room sharing, which the American Academy recommends that the baby be in the room with you at least the first 6 months, if not for the full first year of life, in the room with you, not a separate room, in your room with you, but not in your bed. I understand that some of these cribs are not going to fit in your room. Didn't fit in my room.
Yeah.
No. So the bassinet, the pack and play, the co-sleeper. So there are devices that you can pull up next to your bed and have the front, it attaches under the mattress all the way over to the other side, it has 3 sides and the front part actually is down. So you can just reach across and get your baby right there. Right. Still not technically in bed with you, separate surface, right? And that mattress on the bassinet, the co-sleeper attachment, the pack and play should all be CPSC certified. That is the Consumer Product Safety Commission, CPSC. That's how you know that is a firm enough sleep surface to not put your infant at risk for suffocation. Okay. So there are loads of products because there's, some families perfectly fine with their pack and play. Some people want a beautiful bassinet. Some people want to be able to nurse a little easier. So they want to be able to not have to reach over something. They want to get to their baby, right? The number of products that are safety tested out there is big.
Yeah.
It's not just you've got to try and drag that crib into your but then you can't put anything else in those products. Right? There can't even no burp cloth, no little stuffed animal. If you need a nightlight, it has to be outside of it.
No bumper guards, all those cute little stuff.
No bumper guards, no breathable bumper guard.
Okay. How about swaddling?
So swaddling is great.
Okay.
Right. Makes the baby feel secure. The hospital usually provides the parent with the instruction. The pediatrician can show you how to do it. There are infant swaddled sleep sacks that are just Velcro, right? Takes a lot of the guesswork out of it, but not over 8 weeks of age.
Not over 8 weeks?
No.
Okay. So up till 8 weeks.
After that, the arms have to be free.
Okay.
And why? Because that's as early as an infant is shown to be able to roll over. That baby's rolling over without their arms available. Got it. Now they're at risk for not being able to maintain their own airway.
So, the thing is, I know the whole back to sleep. We did it with my daughter. She developed plagioccephaly because of it, because she's always on her back. So we kind of had to work on that. So that's where for those of you listening, when the head is kind of misshapen, flat on one side. Yeah. But from when we would put her on her back, when she started being able to roll over, she kept rolling over on her stomach. That's what she preferred. And so then people are like, well, is it okay to put them on their stomach once they can start rolling on their own?
So you still have to put the infant down on their back, but if the infant chooses to be on their stomach, that is not up to you. The infant is allowed to do so. You do not have to reposition an infant who is able to roll, who is on their stomach.
Right, because then they can roll away if they need to, back to where they need to.
It's not a problem. Again, as long as there's nothing else in the crib.
Yeah, right. This is kind of obstructing that. Okay, so on their back to sleep, swaddling can be effective, but not after 8 weeks. A firm mattress that's CPSD certified. And they should be in the room with you 6 months up to a year. Okay. What other prevention strategies?
Don't overheat your baby. So keeping an infant warm is important. Obviously, the sleep sacks and these sleep and plays, the zip up pajamas that cover the feet, right, are all you need. An infant who is overheated is shown to also increase risk of SIDS. So don't cover a baby's head. Certainly don't put a blanket over the baby because now that's a soft object and may in fact overheat the baby. So a fan in the room to keep air circulating and keeping the room cool at night. You can't, an infant in an dry, overheated room with multiple layers on is shown to be at higher risk. Okay. Because they're not able to regulate their body temperature just yet. That makes it more difficult for them to breathe. That's the theory, but certainly is a risk factor. What else is breastfeeding? Breastfeeding is, if possible, for at least the first 6 months, lowers the risk of SIDS. Yep. Okay. A pacifier, right? Which is funny. So for whatever reason, sucking on a pacifier, no strap, no string, no clip. The crib. Does at nap time and bedtime reduce the risk of SIDS. The breastfeeding baby, sometimes you have to wait about 3 or 4 weeks to introduce the pacifier so that there isn't issues with latch, but is still shown to be protective against SIDS. Immunizing an infant on the recommended schedule, right? Shown to reduce the risk. Shown to reduce the risk of SIDS. Okay. That may have to do also with reducing upper respiratory infections that those babies can get, which also then increases their risk. Okay. The piece here that this is a subject that won't necessarily reduce risk of SIDS, but isn't necessary. Okay. Is the commercial devices that claim to reduce the risk of SIDS. Okay. I don't know if you're familiar with some of these brands. They're like Owlette, Starlet. They're either a little sock or a little clip for the diaper that monitor a baby's breathing, respiration, sometimes abdominal movement. The Owlette, I think, is an actual oximeter that will Bluetooth the baby's blood oxygen level to your phone. Oh, wow. So that's not an effective tool then? No evidence whatsoever that information will do anything to reduce a SIDS death. The piece to this is that these are commercial devices. They are not medical devices. If it were a medical device, it would require a prescription, and it would require that the FDA review it. As a commercial device, it is, I'm sure, providing some peace of mind. I'm not undermining the fact that maybe knowing your baby is breathing is not somehow comforting. I don't want to minimize that, but the baby's blood oxygen level isn't what's going to tell you if they're at risk for SIDS or not.
Right.
It's providing a safe sleep environment that's important. So these are products that can be wildly expensive, $250, and are not the answer. The number of respirations per minute of your infant napping in their crib is not what is important, right? I think emphasizing what parents can do, what is actually proven to be useful, are these other measures that we've talked about. The monitors are a little excessive. And if you're room sharing with your infant up to the age 1, you are the monitor.
Right. So, Dana, I know one of the things that I've seen recently, and I don't know why all of a sudden it's been popping up, is infant deaths that are occurring when people are putting their infant in a car seat to sleep or nap. Because of the positioning and then them leaning forward, not supporting their head, but there are all these different things that are going on. And so say more about that.
This goes back to suffocation and asphyxiation. So primarily under 4 months of age, but usually it takes up to 6 months. An infant cannot what's called maintain their own airway, right? They don't have the muscle tone to hold their head up like you and I can. So when they're in a car seat, right, chest strap, crunched over, and their airway, which is much more narrow than ours, is compressed simply by the weight of their head, because their heads are proportionately larger than compared to their body.
Right.
The weight of that compresses the much more narrow trachea than you or I have. And because they have not the motor skill yet to lift their chin up, particularly if they're asleep, then they suffocate.
So but they're in car seats when they're in a car. And is it because of the angle that they're in a car seat in the car, because of the way it's adjusted, that makes it safer, versus if they're sitting next to you at a restaurant, the angle is different than in a car seat? Because babies fall asleep in car seats all the time, right?
All the time. This has to do with an infant sleeping in a car seat for the purpose of sleep.
Okay.
So hours in a car seat, right? If an infant falls asleep in the car seat in the car, the first thing is that if the car seat has been installed correctly, it's reclined. Right. That's a big piece about these rear facing car seats, is that it has to be at a certain angle. And why would we don't sit like that in cars. Why does a baby's car seat have to be reclined? And it's because
of that. Got it.
You take that car seat out and just sit it on next to you, or the real interesting technique of the baby has fallen asleep in the car to and from the store, and so the car seat is removed and placed inside the crib.
And so they're not reclining anymore. They're more up front, because the car seat the angle changes.
They're more upright, and B, you're really not within arm's reach anymore. If a baby is sleeping in a car seat and you've just kind of gone on your home duties, versus in a car when they're quite close to you. Okay. So it has to do with the position of the car seat and the amount of time they're spent in it.
Okay. All right. So we have some prevention strategies on the back: firm mattress, no extra stuff, cutesy, Pinteresty stuff in there, swaddling, not overheating the baby, breastfeeding, especially the first 6 months, pacifier, immunization on schedule, and no commercial devices. Right. And so those are all things. Right. So those are all things that really help to reduce the risk. Right.
That's right. That's right. Okay. And So when we're talking to families, because it seems like the biggest issue, though I think some of these things seem very easy to do. There is that piece where parents looking to connect with their baby are the highest statistic that we started off with are the families, the parents who are bed sharing with the baby, which is extraordinarily unsafe. Adult mattresses are too soft, right? So they're not a firm surface. Those king-sized comforters are too heavy for these babies. The ability of an adult to consistently not or be aware enough that they haven't rolled over, right? Or that the infant hasn't rolled to a position in the bed, particularly the story that I'm familiar with and unfortunately have witnessed is the baby that got wedged between the headboard and the mattress.
Okay.
So these are not hypothetical situations.
Yeah.
These are real. It is an adult bed is not a place for an infant under the age of 1. They cannot maintain their own airway. They are too small. The safest place is in your room, not in your bed.
Okay.
After the age of 1, right, there are plenty of cultures around the globe, including in the United States, where the family bed is normal, where children either sleep with grandparents or parents up to many years of age, right? And whether that's good or bad, thankfully, is not for anyone to decide. What I know is under 1, it is not okay.
Yeah.
Right. And so I think as primary care providers, particularly, that we're sensitive to the fact that if a family traditionally or has always been told or was raised to have all the children in bed, at least for some part of the night, it is very difficult to then convince someone that that is not the right thing to do. Everybody else did it. We're all alive, right? So there is, and I appreciate that. I would be very confused as well if that's how I was raised. So I think it's important for us to say the studies show here is what does put your baby at risk for sudden infant death. Keep the baby in your room after the age of 1. If you're bed sharing, I don't have any literature to tell me that that baby is going to be in danger. Go ahead, right? But under 1, please make the smart decision to not do that.
Got it.
Yeah.
Good information, Dana. So what are some good resources then? If someone they're not sure how to put in the car seat properly, they're not sure if they're doing the right thing with their baby, or they're not sure if the mattress is correct, any of those things, or if they've experienced an infant death, unfortunately, what are some resources for people out there where they can get some additional support and education?
Sure. The car seat is thankfully, or should have been, examined at time of hospital discharge. For those families who did not give birth in a hospital, the local fire or police department will come on out to your car and confirm that the car seat has in fact been installed safely. And even your pediatrician can certainly observe you putting your baby in the car seat, at least in the time of the visit, because you've carried the baby in, and can also give advice as to how to do the straps appropriately. So lots of options there to make sure that the car seat is in fact in the right position in the first place.
Right.
As far
as one side note too is that if you've had a car seat and you've had a car accident with the car seat, that car seat needs to be gone. So just want to make sure we put that in there. I think that's why buying used car seats at secondhand stores is not a good idea, because once a car seat has been in a car accident, it is no longer appropriate. So
there's no way to put that in there. Yeah, no way to know what the history of that car seat is. Right?
Exactly. Okay.
Good. The product safety issue, right? So now you have a baby and you'd like to not have them in an unsafe sleep environment. How do you know what to buy, right? That's where the store from which you buy these products, right? The labeling will be clear that it is Consumer Product Safety Commission approved, or CPSC approved. That's how you can be sure that is a safe product. The other thing, which takes a bit of time, but if we're talking about not necessarily looking up every single thing you buy for the baby, you're just talking about, I want to look up this mattress, I want to look up this pack and play. Do a quick Google, make sure there aren't any recalls.
Okay.
That is a big deal, and it's not going to always be advertised. The store may not know, or if it's a product that you're getting, maybe secondhand, maybe from a friend, maybe it's not something you bought, maybe it was a gift. Right? You're not in the store always purchasing these items, especially for a first baby. You can quickly look online and see if it is approved and if it has been recalled or not.
Okay.
For those families who then have, or for anyone who knows of someone who has lost a baby to sudden infant death, there are two online sites that are very useful. SIDS America is the biggest in terms of research and support and bereavement support, particularly for families. So that's sidsamerica.com. First Candle, so the full word first, FIRST, Candle, has a, right on the top bar of the website, an 800 number for 24-hour support for families. The tagline, Saving Babies, Supporting Families. Plenty of literature available and support groups, but their 800 number I find is really amazing for those families who need it right away.
Terrific.
And then lastly, there are two Facebook groups, believe it or not, that have each a little over 5,000 members. One is the CJ Foundation for SIDS, letter C, letter J, CJ Foundation for SIDS, and the SIDS Support. So two different groups, CJ Foundation for SIDS and then SIDS Support, both started by families who had lost a child, and are active communities that families can utilize.
Terrific. Perfect. Okay. And how can people get in touch with you? What are you up to, and how can they get in touch with you for support, for direction, for information, any of that stuff?
I am on Facebook as Dana Nethercott PA. I'm here on Instagram. I have a practical and slightly sarcastic blog at dananethercott.com that is, I think, provides a lot of easy to use tips, but also not as serious maybe as some other parenting sites may be. And I will, by the end of the year, have a book coming out, Parent Like a Pro. Parent Like a Pro will be in the world, and it's about raising your little one. This is primarily for families with children under the age of 5, with confidence and getting clarity on the information that is out there.
Terrific. Great. And Dana and I are fellow ebook colleagues and
alum.
In the journey. Yes,
absolutely.
Exactly.
Absolutely.
So if there's any questions that you all out there have, whether you're watching it live or recorded, please feel free to message Dana directly at her on her IG or any of the other things that she mentioned in terms of Facebook. Or you can send me a question if you have questions about it from a behavioral health perspective. She can give you from the medical perspective. And as well, just go ahead and visit her sites and all that stuff, and that way you can know more about her and all the things that she has to offer. And then when the ebook is released, you can go and support her in that endeavor as well. So Dana, thank you so much for joining me this morning and talking to me about this very, very important issue. I learned a lot of stuff from it, and I really appreciate your time. So
it's a real honor to talk with you, Dr. Lockhart. Thank you so much for inviting me.
Of course. Thank you. You have a great day.
You too.
Okay. Bye.